nerve of a tooth becomes infected, root canal treatment can save the tooth. You may realize you have an infected tooth because it's sensitive to hot or cold. It causes swelling and pain, or it gives you a bad taste in your mouth. You may also be completely unaware that you have an infected tooth because you experience no symptoms at all. The white outside of a tooth that you're used to seeing is the enamel. Inside the enamel is another hard layer, the dentin. There's a small chamber at the center of the dentin called the pulp chamber. The tooth pulp is a soft tissue made up of nerves, arteries, and veins. The pulp extends from the pulp chamber down through a narrow channel, which is the root canal, all the way to the tip of the root. In general, teeth in the front of the mouth have only one root canal, while teeth in the back of the mouth have 2, 3, or 4 root canals. How do teeth become infected? Deep cavities can allow germs to get into the pulp chamber. These germs cause infection and the pulp dies. The pus from the infection eventually builds up at the root tip and makes a hole in the bone. This is called an abscess. This cavity entered the pulp chamber here and caused this abscess, which is the dark area at the tip of the root. A blow to a tooth may also cause the pulp to die and then become infected. An infected tooth will never heal on its own, and as it gets worse, it will continue to be a source of infection that drags down your immune system, and that can affect your entire body. This damage to the bone and the swelling inside the bone can be excruciatingly painful and even life-threatening. Years ago, an infected tooth would just have to be extracted, but today, we can save your tooth with root canal treatment. Root canal treatment and restoring the tooth usually involves 3 steps. First, we remove the infection to promote healing. Next, we place a post to strengthen the tooth, and then we crown the tooth to protect it. We want the entire procedure to be comfortable for you, so the first thing we do is make sure you're thoroughly numb. We place a rubber dam around your tooth to isolate it from the rest of your mouth. It protects you like a safety net. Nothing can fall to the back of your throat. It also keeps the tooth dry and accessible so we can do a better job. To get at the infection, we make an opening through the top of the tooth down into the pulp chamber. This is a dental file. We use it to carefully clean out the infected tissue and shape the canals to receive the filling material. We take x-rays to make sure that all of the infected pulp is removed. Sometimes it's necessary to strengthen a tooth with a post. The post reinforces the tooth. It's cemented down inside one of the root canals. Making a crown is the last step in restoring your tooth. It protects your tooth and gives you back your smile. Once the pulp of a tooth has become infected, your choices are limited. You could choose to delay treatment. You could choose to have the tooth extracted, or you could choose to save your tooth with root canal treatment. The problem with delaying treatment is that an infected tooth will never heal on its own, and this can lead to some very serious problems. As the infection spreads down the tooth and into your jawbone, the pain may become excruciating. It could even put you in the hospital and threaten your life. An extraction is only a short-term solution. While it does remove the source of infection, it sets off a chain reaction of shifting teeth and other dental problems. The only way to save your tooth and keep it in your mouth is to remove the infection with root canal treatment.